Well, good afternoon, everybody. Thank you so much for joining us here in Berwick on the autumn evening, afternoon actually. And huge thank you to those who've been attending the information this morning, especially those organisations that have made it possible that we start here the staff here at the Maltings. It's been a fantastic exercise for all of us. I am Peter Stanfield. I'm the chair of Healthwatch Northumberland. Just say that.
Can't hear you.
I can't get much closer to the mic. If I put that, is that better?
Yes,
Thank you. Thank you for pointing that out. There we go. I'll put that there. I'm not doing much of the talking, to be honest. So there are roving mics, but if you can't hear at all, do please let us know. I'm going to introduce, although Isabel needs to introduce introduction to me, but Councillor Isabel Hunter from Berwick West and North, and for a forum.
Good afternoon, everybody. Welcome to the annual event, and I hope you have a good afternoon and you've enjoyed this morning. We've got some interesting speakers, and as well as a question and answer session afterwards. I am County Councillor for Berwick West with Ord on Northumberland County Council, and have been since 2005, apart from 4 years. I do represent the area and do promote as much as we can to Healthwatch, because it is a fantastic organisation to pick up any local issues as well as it can be national issues, because what can be a simple issue to you can build into a bigger picture, and we can try and get services amended, especially locally. So now, with further ado, I hand over to Peter Stansfield, the Chair of Healthwatch Northumberland. I hope you have a very good afternoon. Thank you.
Thank you very much. We have a very small formal part to today's session. There is a pack of information around which I'm hoping you've had a chance to have a look at. In there is our annual report, and this is effectively what we're presenting. For those of you familiar with company AGMs, you may be wondering why we're having it at this time of year. Our Healthwatch year runs from June every year. So in effect, we're reporting on the year up to June 2024. We'll have a very brief overview of that, and Derry will talk you through it shortly. We also have in there some minutes from the previous meeting, and more importantly, we have some sheets of paper on which we'd be delighted if you wanted to jot down any questions that you might have. We will have some time for questions, but not a huge amount, but we are a listening organisation, so if you have any questions and we can't take them, we have lots of experts in the room from various organisations. Thank you to all of our speakers, whom you will meet shortly, but we can take them away and we will get back to you. I think we've probably got most of the people in the room who are coming to join us. I do need to just point out that we are not expecting any fire drills, so if an emergency should arise during our brief meeting here today, please follow the instructions of the Maltings staff, and we will all be very safe. Okay. I am sort of formally required to ask whether anyone has any questions on the minutes of the meeting from last year. Not a very long meeting. I'm just about to bring this year's to a conclusion. But if you do, then either shout now or come up and catch me afterwards, and we'll be very happy to answer those. Okay, so in the time we got together, we'll hear about the work that we've got going on. We've got some very good guest speakers representing services that are currently delivering in Berwick, and as I said, we'll have some questions at the end. Okay, so within our annual report, we've covered the activity for last year. These are our board members. We're not a very big board. We do have some organisational representatives, and we have some independent members. Enormously grateful to our board members. These are the people who've served through 2023-24 all the way up to June, and some of them are here today. I'm delighted to say that we've recently recruited 2 more who will serve in 24-25. So Dawn Porter and Alison are now formally members of our board, We're also allowed to co-opt. One of the things you'll see from the report is that we are keen to increase our reach, particularly to groups whose voices might otherwise not be heard as loud or as often as they might be. So we have co-opted 3 new members who are just in the process of bringing on, and I'm delighted to say they bring a range of both expertise and geographical reach that's very welcome to the organisation. We also have volunteers who don't serve on the board, and they are invaluable to us. We welcome 3 new ones, some of whom are here today. Thank you for giving the time that you do to Healthwatch. It's not a lifelong commitment, so we say goodbye at the moment as well to 3 others, and we are enormously grateful for the time that we've had. And hopefully they will have benefited from the process, but we've certainly benefited from the time they've given to us. Okay, that's it for the formal part of the 5-minute annual meeting. I'm going to hand you over to Derry, who will talk you through a very brief summary of what's in this document. Do take it away, it's available online as well. It's a brief overview of our activities last year, and I will leave Derry to explain all that to you.
Thank you, Peter, and I will reiterate Peter's thanks to everyone who's attended this morning and as well as this afternoon. I think the hubbub in the room and the heating in the room earlier is testament to just how important networking is to us as an organisation, and much of what I'm going to talk about, which is covered in our report, could not happen without the relationships that you saw manifested in that room this morning. So the thing that we always say about Healthwatch is that there is a formal framework, and I think it's always good to remember what we're here to do, because it's one of those organisations that people say, well, we don't know, we've never heard of it, and what do you actually do? So just a quick run through. There are things that we must do by statute, because we were created by the Health and Social Care Act 2012. So we have powers and duties and things that we have to do. And they are the things which you can currently see on the screen. It's worth repeating that these are the things that our annual report, which you will have a copy of, we should be able to show in that report that these are the things that we are delivering across. It's also worth repeating that because of, our official description is that we're a champion for people who use health and social care. And I think that's sometimes difficult. What does that mean? So it's worth repeating that we cannot make services, health and social care services, change, or we can't shut them down. We're not a regulator or anything like that. Our role is to make sure that those who do have those powers have the information to do so that they're not making decisions. They're making a decision on the best available information. And that information starts with you, with everybody who uses health and social care services in Northumberland, which is all of us. And that is why the golden line goes across those functions, because nothing can happen with Healthwatch unless we gather evidence. So everything we do is based upon evidence. Each local authority has to commission a Healthwatch, and that's always worth remembering as well, but they have to commission the function. How that actually happens varies, but this is how it happens within Northumberland, and we are immensely grateful to Northumberland County Council for its continued support of the Healthwatch function and the value that they tell us that they feel they get for that contract. Just a reminder that contract is held, the Healthwatch Northumberland contract is held by Adapt North East. And it's a model that within that contract is that Adapt set up a board, which you've seen earlier, who sets the strategy. So that is the purpose of our board, to set a strategy for Healthwatch Northumberland and to make sure that that strategy is delivered through our annual plan of work. This year, though, things have moved on slightly as well, is that the Integrated Care Board, of which you will hear much later, formally recognised the importance of Healthwatch as a function by supporting the network of the 13 local Healthwatch in the North East and North Cumbria, so the footprint of the Integrated And that is really important, because what that has done has given us a seat at those tables and in those places where decisions are made. Not to make decisions, because as I said earlier, that's not our role. We're not decision maker. But it's strengthening our ability to get your voice heard. So that's why that's so important, and we're very grateful to the Integrated Care Board for recognising that, and I think it chimes with what they're trying to do. And I have to say, it is a model that's a standout of good practice for integrated care boards across England. It is something that's been recognised as a really good model for what they've actually done, and not every ICB has followed suit. So that's who we are and what we do, but what have we been doing? The annual report shows what we've been doing and how hopefully we've fulfilled our statutory functions, and we're happy to answer questions about that at the end of this presentation. I'll particularly highlight some of the things that we've done. The work on health visiting. This was a report that came out of some work we did in Blyth on a different issue entirely. But when we were working with, it was actually within the family hubs, we started to pick up issues and people talking to us about the health visiting. And so we thought, well, we need to know more. And my colleague Helen did a fantastic job of organising that, working with the volunteers to actually get a really good feel and listening to, I think it was 90 parents in the end, or groups of parents listening to what they had to say. And we're really pleased that Harrogate and District Foundation Trust, who provide the 0 to 19 service in Northumberland, really got behind the process and the project, and they've put together an action plan to address some of the recommendations. I think Janelle's here today from the foundation, and I think it shows just what you can do if you are focused, you get as I say, you gather the evidence and you present it in a way that is reasonable basically and doable and achievable. So we're really pleased by that, and I have to say that I'm also very pleased that last week Healthwatch England, which is our umbrella body, highlighted the report to the whole network by saying that what makes this report great is not just the topic, which isn't covered that often by Healthwatches, but also the analysis of key findings by postcode, amongst some other things. And again, I think that's important to us, because one of the things that we are very clear about is that we need to target our work to people who are not often heard. And one of the ways that we all know that we've got doing that is that link between where you live, i.e. your postcode, and how you sometimes get experience services or don't experience services. So we were very pleased that was recognised. And I know it's something that the board is on about all the time to us to say, please try to find out where people are living so we know that we're getting the right, that we're hearing from the right people. The problem we have is that showing that we have influence is always tricky, and the timescales can be lengthy because we are working with huge structures, huge systems, where although change is happening, and sometimes it's happening very fast, it still sometimes takes a long time. And that's why in the report I was very pleased that we were able to see a quick response from NHS England about the vaccination programme last year. And we're also pleased to see that arrangements for this autumn's booster seem to have gone more smoothly. Unless you know any different, in which case please talk to us afterwards. But I think again it shows that having the right relationships, the right people to phone up and say, oh, we've heard this is going on in this particular locality, can you see what's happening, and that really, really made a difference, as is reported in the annual report. I have to say, for people in Berwick, dentistry is still an ongoing issue, and we know that, and we've got a statement from the Integrated Care Board, which we'll publish later on, which addresses it, but I cannot stand here and say that that's solved. It is an ongoing issue, because the nature of that problem is at the very highest level. That is a governmental change that needs to, that's legislation that needs to change. It's not something that is within the gift of the ICB locally, although there are things that they can do to help that along. We must all recognise as well that our duty to influence to improve care can mean influencing to maintain or not see a deterioration in care. The work that's documented in Longhoughton and Harbottle epitomises this, and the importance of engagement with communities. And I think both of those pieces of work show that very, very clearly. Both communities there spoke up and made a difference. And we commend both Northumbria Primary Care and Alnwick Medical Group for listening and acting on what they heard. And again, I think it's that thing that sometimes the change line is very short, sometimes it's long. And I think in both of those cases, it just showed that, you know, when you've got the strength of evidence, when agencies do the engagements, and, you know, I was at those engagement meetings in Harbottle, and Cara was there, who was here from the Northumbria. We were at those meetings, and, you know, basically that was, everybody had their say, and it was really, really good. Heartening, I think, is the word I would use. So we often get overlooked or it gets overlooked that we also give advice and information, and I think the three things that I would highlight to you this year particularly are our cost of living leaflet, which has been picked up. Many people in this room have got it, are using it in their own agencies, and I'm really pleased that we were given funding to get it translated, because we know from our engagement with certain groups that some of the reasons that people don't take up, some community groups don't take up services, is because they don't know about them. And so getting that stuff, that leaflet translated was just absolutely vital. We've also got a new leaflet on mental health services, and if you haven't picked up a copy already, please do, because it is a theme of today about mental health services. So again, I would commend that to you. The other thing that we've been doing this year that I want to pick up as well is we've been visiting care homes. This is something we started literally just before the pandemic. Of course, that went on hold, but we've started again. And again, I am really pleased that one of the county's providers, HC1, we visited 3 of our homes recently, and the report's just about to come out on those 3 homes. And it was a really positive experience, really interesting, insightful. I hope they found it, we certainly did. But I think one of the things that's going to come out, and it's a question that an issue that I'll throw over to you really, is that I think there is a case for how we as communities support, know, engage with people who have chosen, or has been chosen for them, to live in a care home. And I think that's a really interesting thing. I think that's something that we will have a longer conversation about with people. And I think it's probably something that I'd want to pick up with thriving communities as well, because I think that's quite an interesting thing that came out of those visits. But I do thank all the 3 homes that worked with us on that. So what are we doing this current year? Because this was talked about last year. We're doing more of the same. We have got a very exciting new project starting in schools. We've got some of the high school students in Hexham, but we're piloting it because we want to see if we can make it work across high schools in other areas. That is being led by the students, and they want to be ambassadors for Healthwatch. They want to get out there and hear what young people's experiences of healthcare is, so we're really excited about that. We will continue to do all of the out and about that we do, going around different areas, our here-to-heres, and we'll tweak those as we need to. Our focus on social care is very important to us because, again, with a name like Healthwatch, our remit covers social care, but our name is Healthwatch. So it's a bit, we forget that, other people forget that. So one of the things that's been really important to us this year is chairing the Adult Social Care People's Panel, which is a group of people who have come together who either use adult social care services or are carers for people who do, and have had a really positive input into aspects of care, including getting involved in training frontline staff on carers assessments and making a real difference to the information that's on the council website about care. So we are looking for more people to get involved with that. So if you are receiving care from adult social care, or you're a carer of someone who is, get in touch with me, see if the panel is something you want to be part of. We will continue to do things like our annual survey, and that will be early next year. So, because that is really important, because that's your way of telling us what you think we should be working on. And if you look in the annual report, you'll see that the 3 issues that we want to work on came directly from our last annual survey. We will work with the 12 other health watches in the North Eastern Cumbria, as I said earlier, because there are big things going on at national level about health and care. We've had the DAS report about patient safety. We've had the announcement this week of the 10-year engagement plan around the NHS. All of those things will be better with public involvement. And Healthwatch England and local Healthwatch are built into that, into both of those. So I think it's really important. And if you keep an eye on our stuff, you'll see that we'll be promoting of how you can get involved in the 10-year plan, for example. So really, do keep an eye on that. But as I say, overall, what we will do this year is continue our statutory functions to use your experience to hold services to account. But, and this is the point I want to finish on, we will do so in partnership, recognising our respective roles and the challenges we all face, and in the spirit that was engendered in the room this morning. So thank you. Has anyone got any questions on the annual report or any of our work?
I would like to ask a question.
Yeah, I can't see you.
I'm at the back.
Okay,
Oh,
yeah.
right.
I think there's a roving mic coming to you. If
Yes,
we can get someone
hello,
to.
yeah, I'd like to ask a question.
Yeah, please.
I have been waiting years for a cornea transplant, and I just found out this month from my consultant that there is such a thing as an artificial one, but the NHS won't pay for it. It would be interesting to know if they and NICE are looking into this.
Okay, that is something. What I will suggest we do is that one of my colleagues will talk to you after the meeting, and we get some more details from you so that we can get back in touch with you. Unless anyone from the health service has got an answer to that, but I don't think it's any of your specialities. No. Which trust is it? Is it Newcastle or?
Yeah, the RVI.
It's Newcastle Hospitals. Yeah. So what we'll do is we'll get your details, and we will do some investigations. I think that's a good bit of information finding out that we need to know about. So thank you for raising that.
Okay.
Any other questions? Yes, gentleman down here.
Hello, Richard Tilsey. I'm a GP at Belford, and I also lead for the local PCN on the enhanced care, health in care homes framework. So I was interested by your visits into care homes, what your remit was, and what outcomes you might get from that.
Right, our remit when we visited care homes. Are Andrea and Joanne still here from HC1? Yes, they are up there. They're just up there. Two of the managers from the care homes, two of the care homes we visited. Our visits to care homes we do under our function of enter and view. We have the power to enter and view premises where adult care is being given, whether it's health or social care, so anything basically, including your surgery. So we did it under that, but the remit was to understand what good looks like and to understand people's experiences of care. And I think when the reports come out, I think you'll see that. I mean, there are also always things, and I think Joanne and Andrew will probably agree that there were insights that our visitors saw that gave to you that were just, that it's always good to have that fresh pair of eyes, isn't it? But I think the thing that came out for us was that thing about that people still want to be part of the community, still want, where people have capacity and ability, but even where they lack capacity, sometimes they still want that ability to engage. And I think, what we saw in the care homes that is really facilitated. But I think there's more that we as communities can do. And I think it's about that not being forgotten, that it's not behind closed doors. So that's what I would say we learned from that.
So do you imagine visiting all the care homes in your particular area and sort of coming out with, I don't know, a Trustpilot review or TripAdvisor maybe? I suppose what I'm thinking of, people find it difficult to choose, and you know, it's not an uncommon question for us in care to be asked about where, you know, and clearly some care homes have a particular aspect, particularly elderly and mentally infirm, but it's also about what suits people and what you know, where. And I've had personal experience with my father-in-law in a care home locally, so that would be very useful for people to at least get a flavour of what individual care homes are like.
I agree, and that's the point of doing the reports are public, because obviously they have to be. We are doing it under a public duty. So the reports are public and they form part of that information. So if you remember what I said earlier about people being decision makers,
Yes, sure.
and actually the group of people you're talking about, so the people like myself, when I was looking for a care home for my mum, we need to make decisions on the best available information, and the more the better.
And sometimes that information is a bit haphazard or not, you know, instantly available.
And these are lay opinions. So this isn't, we're not the CQC, we didn't go in and look at, you know, care records and all of that. This was saying we were talking to residents about their experience.
And I think in choosing a care home, that's more important.
Yeah,
in some
absolutely.
respects, you want a good CQC, but actually it doesn't tell you about what the experience is in the home. You know what the staff are really like to you, whatever.
You want to know the day-to-day experience. Yeah, and I think hopefully what you'll see in the reports, and I think Andrea, yes.
I'd just like to say, obviously, our services are very service-led. So basically, we want the recommendation from our residents, because it's all about resident care and the best outcomes for our residents. We want our residents to live their best lives. So again, community involvement for us is basically everything, because we are trying to be part of the community. We're going to a community group at the moment, but in our area, it's very hard because not a lot of people know we are there, even though the room's been there for 30 years. And it's about having the community involvement as well to spread our good practices as well, so people don't get the bad about care homes, so you know it's about the positive outcomes. And again, you're on about information from families and residents themselves. So you do have a website called carehomes.co.uk where you can read comments by family members and residents who live in the homes, and that's how you can get a scope of what the care home's about and what we offer.
Yeah, that's really, and again, I think that's you put much more succinctly what I was trying to say, that it is about care homes are part of their communities, and actually how care homes interact and know about them and interact with them is just really important. What I'm going to do is I'm going to draw this bit to a close now. So if you have any more questions about our work, then there's a green box outside, just pop them in there. So any questions either to myself or to the guest speakers today that we can't cover today due to time, we will endeavour to get you an answer. So we'll publish it, but if you want a direct answer to yourself, like the gentleman at the back, then we will get it to you directly as well. So thank you for your questions. Now we go on to talking to the services that are delivering in Berwick. This whole idea came out of a meeting that we were part of in March, where a group of residents working with their local elected members were concerned that they didn't know about, they weren't getting the mental health services in particular, or didn't feel that they were accessible to them. And the services came up and we had a really fruitful meeting. But I just thought it would be good to hear what's missing and what services are. So, in fulfilling our duty for information and signposting, I am absolutely delighted that Thriving Together and RISE, which is one of the providers, the North East and North Cumbria Integrated Care Board, Cumbria, Northumberland, Tyne-and-Wear, NHS, I've missed your S off there, apologies for that, NHS Foundation Trust. We will call it CNTW because none of us have got enough time to be saying all of that, and Northumbria Healthcare are going to talk about how they are delivering in Berwick. So I'll ask Nicola Duffy and Jackie Duffy, no relation, I'm assuming. No, none of you think that. To come and tell us about what they're doing.
Good afternoon everyone, I'm Nicola Duffy, Programme Director for Thriving Together, and I'd like to thank Derry and the team at Healthwatch for inviting me to speak to you all today about what the voluntary and community sector are delivering in Berwick. So first of all, who we are and what we do. So Thriving Together has been commissioned as the voluntary and community sector support by Northumberland County Council since 2021, and we are part of Citizens Advice Northumberland. We have two key missions. Firstly, to make sure the smallest voice in the sector is heard, and secondly, to build the capacity of the voluntary sector. So how do we go about achieving those aims? So we have 16 networks which are based on either a geographical or thematic alliance, and one of which is the North Northumberland Voluntary Forum, which many of you will be familiar with. We also have other networks such as Women's and EDI, and we're just in the process of forming a Veterans Network. We hold quarterly meetings for the network leads, and that's an opportunity to share challenges, best practice, collaboration, and also to suggest items for the VCS liaison meeting, which is our touchpoint meeting with the local authority, and an opportunity to raise those key issues which are affecting the sector. And our networking events, so we've held 12 since the start of the commission, and they've been held throughout the county. They're an open invite, kept deliberately informal, an opportunity to start those collaborations and conversations, and crucially to obtain feedback from the sector. Very well attended events. And through our communications, we have regular updates on social media, and we use that to share the excellent work happening in the voluntary sector. We also have a twice monthly newsletter which has nearly 500 subscribers, and it's a great way to share service updates, upcoming events, job vacancies and funding opportunities. And our wonderful community connectors, Helen and Maria, who you might have met earlier in the marketplace, and they provide that one-to-one support to VCS organisations, helping them get linked in with local networks, signposting to governance and funding opportunities. And using that feedback which we get from the sector, we provide representation at strategic forums with wider stakeholders such as the local authority, NHS, combined authority. Training opportunities, we've facilitated multiple training sessions, and coming up in November we have a digital learning day with Digital Voice, which is to provide training on different aspects of media, and we're also holding an information session on managed migration to universal credit, and that's been provided by the Welfare Benefits team at Citizens Advice. One of our most important roles is acting as a conduit to funding, and we've leveraged £2.5 million worth of funding to the sector since the period of our commission. A large part of that funding has been acting as the lead accountable body for partnership projects to provide skills and employability training through funding from the North East Combined Authority. And going back to our events, in October we held an event at the William Elder building here in Berwick, and this was a joint event with RISE. Slightly different to our usual networking events. It was a little bit more structured, and it provided the opportunity for voluntary and statutory services to come together, share information about their services and their offer to the residents of Berwick in order to improve knowledge and encourage referrals across agencies. And this is some of the feedback we received showing the real benefits of the session. And you'll see from this slide, this is the range of agencies who attended. We had 36 attendees from 21 different organisations represented. And I'd now like to invite Jackie and Diana from RISE to speak about the vital work they do for communities in Berwick.
Hi. So my name's Jackie. I work for a charity called Rise, who are funded and supported by Sport England, and they are part of 42 active partnerships across the country. The Rise vision is to create a higher quality of life for communities that need it the most in Northumberland, in time when we are using the power of physical activity. They tend to work within Rise, the organisation tends to work business to business. Our strand is a more place-based approach in Berwick, and my role is as a key worker supporting males aged 16 to 30 within the Berwick borough area. And the role itself is generally, the criteria is age 16 to 30, male, and whatever may be happening that can impact on their day-to-day life. My role is trying to navigate them through the right services that will make that difference. And I believe the slides will be sent out after this presentation. There is a link on there to a YouTube video that was filmed with one of our service users, and I think that explains the service far better than I can ever give credit to. So if you have a look at that after when you receive it. And I'll just introduce you to my colleague Diana, who started with us in April.
Right. So my role is community development, which is taking a much more general approach to what's on offer in Berwick to support people's health and well-being. Rise is focused on getting people who are less active more active, and that can mean actively engaged. So it's not just sport and exercise. So, and I also look at some of the skills that we gain from being involved and the impact on employability and life outcomes. So I'm looking at what's there already, how well is it accessed, what barriers prevent certain groups from taking part, how can we improve the access or the take-up of activities, can we help to establish more, or can we enhance what's there. So yeah, that's a bit. Over the summer I did some youth voice. This is an example of one of the questions. We also did some focus groups with young people. It was interesting because some of the differences in terms of the feedback at a focus group in a group environment as opposed to an anonymous survey. For example, this question, this one, it's clear that cost is a big barrier for young people in terms of taking part. Obviously, they're less likely to mention that in a group environment because there might be a stigma involved in that, and that's something that perhaps we need to be aware of. So that's something I can feed back to providers and partners that I'm talking to that might want to change their services to make them more appealing to young people. And then the next one is another example of one of the questions we asked. And you can see from that what's important to young people is that the stuff is nearby, that it's aimed at their age group, and that they want to socialise with their friends. Obviously, it's a lot more complicated than that, and there were a lot more questions than that. So if you are interested in finding out more about that, then get in touch and we can talk about it. You'll get a copy of these slides. This is an example of an activity that came out of that youth voice. This is a darts taster session at Northern View, and the idea is that will develop into weekly or fortnightly coaching and perhaps establishing a junior darts league. And as you can see, it was very well supported and appreciated by those that came along. So this is how you get in touch with Jackie or me. And we also have a new website that's launched this week, which you can have a look at. Is there anything else? Great, thank you.
So just before I finish, I just wanted to talk about how you go about finding out what services are available in your area. So Frontline Northumberland is an online resource providing information about health and wellbeing services throughout the county. platform is accessible both to professionals and the public. It's free to use. It's been running for over 2 years, and it's funded by the ICB and Northumberland County Council. And there's a total number of 383 services registered, with 314 currently accepting referrals. And it's available via PCs or the app. You simply search for your area and the keywords and services for the help you require. Professionals can make secure referrals on behalf of their service users, and the public can request callbacks from organisations. And in terms of referrals, it has about a 96% success rate. So it's a very, very useful tool. If anybody's interested in, any organisations are interested in becoming registered with Frontline, then if you get in touch with ourselves, we can put you in touch with the Frontline team who can help you get started. And just whilst we're looking at delivering in Berwick, I want to do a quick plug for the wonderful Choices for Growth. They offer counselling here in the Berwick locality, and they have a walk-in session this afternoon between 3 and 6 at the William Elder building. Just move on there. So if you'd like to get in touch with us, you can do it at our email address, which is on the screen. There's also loads of additional information about ourselves on our website. If you just search for Thriving Together Northumberland, and that also includes our latest impact report, which is, details everything we've done in the last year. I'm conscious of time, so I'll finish there, but just thank you for listening.
So much for that. That got us off to exactly the right start and answering the question about delivering in Berwick. We are now going to move on, and I'm going to ask Jane Walker from the Integrated Care Board to join us on stage, and she will explain, well, hopefully what the ICB is and what you're doing. But Jane's focus is mental health, learning disability, and autism. I don't want to spoil your.
Oh, isn't this exciting? I hadn't quite expected a venue like this, but it's lovely. And so good to see new faces and faces that I haven't seen for quite a long time. It's really lovely. And it's always dangerous when I have a microphone, because I always feel that I need to, I don't know, start a Britney Spears song or something like that. But don't worry, I'm not going to. I'm not going to do that to you. But it's always at the back of my mind, so bear that in mind as I sort of talk through. So firstly, thank you, Derry, so much for asking us to come along and talk today. It's an absolute pleasure to be up here in Berwick. It's an absolutely beautiful part of the world, and we're really keen to work with the people of Berwick to get things how they need to be. So I'm going to start in that vein. So my name's Jane Walker. I'm Head of Mental Health, Learning Disability and Autism across Northumberland and North Tyneside local delivery teams in the North East and North Cumbria ICB. So that's a real mouthful. So you can imagine when I'm presenting myself in meetings, it takes a long time to get through that. So I'm going to have a go and see if I can get this thing to move. There we go. So Derry asked me to come along today to talk about the ICB's priorities for mental health, learning disability and autism for 24-25. And actually these priorities will also fall into 25-26 as well. I've not got a huge amount of time, but I'm going to try to get through them as quickly as I can and give a little bit of an overview. So, and hopefully that will be sufficient. If there's any questions at the end, that's absolutely fine. But you know where we are. You know, this because we're here today, it doesn't mean that we wait for another year before we get together. And Derry and I work on lots of different projects as well, so we're always in contact. Community mental health transformation is one of the key things that's absolutely tippy top of the list for our ICB, but also nationally. And I'm going to come back to community mental health transformation in a later slide, if that's all right. Another key area of work for us is around inpatient quality transformation. It's a national initiative. Again, it's about us understanding our inpatient services. Are they the quality services they need to be? Are our environments appropriate? Are we seeing are we seeing are we giving people the most appropriate treatments in our inpatient services? So it's a huge piece of work, and it's taking place across the whole of the ICB. We're working really closely with our partners in CMDW and also in TUVE, that's Tees-Esk and Weir Valley. And I probably should have started by saying the ICB is a relatively new organisation. We've been in place for 2 years now, and we cover the whole of the North East and North Cumbria. So it's a huge, vast kind of area compared to the way that we worked not that long ago in our clinical commissioning groups, where we were tasked with providing services for very small local areas. So it's a very different approach that we're taking now. And it's taken a bit of time to get us to a place where we're able to focus on those kind of wider communities. But of course, for local delivery teams, we're really keen that we maintain that close relationship and working with the people that are most important, those people on the ground. So I'll go back. Urgent and emergency care is another area that we're really keen to look at. And this is about what happens to people when they're in some crisis, whether somebody attends an A&E department, whether somebody is so poorly that sometimes statutory services like the police are involved, or allied mental health professionals in terms of mental health assessment being required. What happens? What's the sort of pathways that we've got in place at the moment? How are we ensuring that those people who are so ill, often require a kind of service and support that that needs to be in place, and where actually at that moment in time they're really unable to care for themselves and the people around them. So we're looking at how do we work together across all of our trusts. So this is about our psychiatric liaison teams, our crisis teams, our teams out there in the community that aren't statutory services but the voluntary sector. So very much thinking about the sorts of services that we've just heard about. How are we all working together to ensure that we're providing exactly what an individual needs? Another key area is around building the right support for people. This is about thinking about those individuals who leave hospital, they've had a hospital admission for mental ill health. How do we ensure that those people are equipped to deal with life in the community? How do we ensure that we've got all of the right services wrapped around them to prevent a further admission and to help them thrive out in the community? So there's again, these are big areas of work, and you can see why there are only 6, because they are they're complicated. We're dealing with very complex pathways. Another area, and it won't surprise you to hear this, is around neurodevelopmental pathways, and this is around those people with autism or ADHD. And it's about, we understand that nationally there's a huge issue around weights in neurodevelopmental pathways. So we're working together across all partners to think about how best we improve the situation. So this is about understanding the need of an assessment, how we assess people, the person's needs, because not everybody feels they need an assessment, and then what do they need in terms of support following a diagnosis, or even if they choose not to. So again, big piece of work. The other thing for our ICB, Integrated Care Board, is that the board is now in place, and these boards are in place across the country, to ensure that services are equitable everywhere. It doesn't matter where you live, so we cut the postcode sort of lottery of accessing healthcare services. So there's a strand of work around population health management, and part of what we're doing is really trying to understand all of our communities across such a big patch, and then understand where the gaps are, what's working really well in some areas, and actually what needs to be improved in others. And we kind of talk about, and you may have heard this phrase before, almost a levelling up, so that we ensure that all of the correct resource is applied where it's needed most. And again, that's a very different way for us to work when we've previously worked in a very focused way in our communities. So very broadly, those are our areas of focus. Excuse me. Okay. We can't do it on our own, obviously. So we do have enablers that we need to think about. So obviously co-creation is important. Thinking about and working with people who have experienced services is absolutely key. And ensuring that our services fit around the needs of individuals. We're not all the same, we're all different. We respond to things in different ways. And I think that that is something that services within mental health, whether it's learning disability, autism, or that more general kind of mental health field, we all are really clear that the intervention, the interactions that happen with clients and services needs to happen with an understanding that we're all different. So that holistic approach is so important. Absolutely integration and collaboration with our partners, so people like Derry, for instance, are absolutely key in ensuring that we work together across the system. We're all aware of the part that we all play, and that part is an equal part. It's really important to focus on that. And that ensures everyone has a view, everyone has a voice, and everyone's voice is just as important as the next, regardless if you're a voluntary sector or a big trust. Yeah. We need to make sure that our priorities have the impact that we need them to have, and that they're clinically led and they're quality services. And we can't do any of that without an appropriately trained and supported workforce. I said I'd come back to community mental health transformation principles because I think this is really key for Berwick and the people of Berwick. We've listened to you. We've been and spoken to people, residents in Berwick, and it was about 6 months ago. A lot of what you told us really chimed with community mental health transformation, thinking about services being closer to home, not needing to travel as far to access services, people telling their story only once, there not being a wrong door, so wherever anybody goes for support, actually that counts as some access, and that person will then take responsibility and take your concerns further if that means accessing the service. But we get access quicker and easier, that we have that whole system involvement that I've talked about before. And overall that there's a much more creative way about how we deliver our services. And absolutely I'm seeing that happen more and more every day, and that's certainly since the last 3 years since we've been working in a transformation kind of way. The key thing with transformation is that that it's also focused on physical health of people, and absolutely acknowledging that physical health is so important to somebody's mental health, and also it's person-centred, so it's got that engagement and co-production that's bedded throughout. One of the things that I have been doing is working with those services that we do commission. And what I've done is I've listed all of the services here that do have a presence in Berwick and offer a range of different services. Now, I appreciate there's not a huge amount of time now, but I'm really keen for us to talk through, obviously at a later date, some of these services, where they're delivered from and how they're delivered, and to ensure that that information is shared widely and openly with residents of Berwick. I think that's really important, and something that I think we identified is probably a bit of a gap when we all last met. So one of the things I just wanted to quickly say is, and I know we've got some representatives here of our recovery college. Our recovery college is a bit like our cement in Northumberland for our community mental health transformation, voluntary sector led. We have the recovery college has really grown from strength to strength over the last couple of years, providing a huge amount of support to people out there, not just with mental ill health, but actually the whole population of Northumberland. So anyone wanting to get out and about, to join groups, to learn more about something, to find advice or information, I absolutely would strongly recommend the Recovery College, and also advocate the use of frontliners, as already been mentioned. Absolutely on the same page there. I think I'll leave it there because I'm running out of time by the looks of Derry. She looks very uncomfortable, and I could talk for a while.
Thank you, Jane, and yes, thank you for noticing my call. I think what you have just outlined proves that the conversation that started back in March is one that needs to continue. So although this is 6 months on, it is obviously a thing that needs to continue, and that we will probably want to be looking at ways to help it to continue as well. So I will ask Chloe Mann and Kath Elliott from Cumbria Northumberland Tyne and Weir Foundation, CNTW, because that is what we're going to call it, to come and talk about what the Trust does. Yeah. All yours.
Good afternoon, everyone. Real privilege to be here today in this absolutely gorgeous venue. I have to say, I've never been here before, and it's stunning. My name's Chloe Mann. I'm a place director covering the Northumberland, North Tyneside, North Cumbria area, working for CNTW, community services, access services, so crisis and liaison is within my portfolio. And I'm joined by my colleague, Catherine Elliott, who's our Associate Director for Community Services. Cumbria Northumberland Tyne and Weir Trust is a massive organisation, and as you can see from the map, we cover a huge area, Gateshead, Newcastle, North Cumbria, North Tyneside, Newcastle and Sunderland South Tyneside. We do have a number of hospital sites which we've added to the map. You can't see it here, but they will be within the slide pack. So the local hospitals to ourselves here in Berwick would be St George's Park, based in Maltings. We've got our secure services and learning disability services based at Northgate Hospital in Maltings as well, and then another range of services for inpatients across the footprint. I'm going to try and work that. So about the Trust, we have a local population of 1.7 million, so we look after a lot of people. We're a huge employer with over 9,000 staff, so lots of opportunities for people to come and work with us. And our catchment area spans over a significant footprint. Our services are delivered from over 70 sites across that area, and as you can see, it's a massive geography in terms of getting from A to B. We've got a number of regional services and national specialist services within our organisation, and we work across 8 local authorities with a turnover of around £537 million. So we're big. What do we provide in Northumberland? So this is Northumberland in general, and then I'll hand over to Kath to talk about some of the current developments for the area that we're in today, Berwick. We've got a dedicated crisis team that is all age, and that's available 24/7. Every day of the week we're available, and we come out to see people where they need to be seen. So whether that's a GP practice, whether that's somebody's home, a relative or carer's home, or a hospital site. Our crisis team aim to respond to people within 4 hours for a very urgent response time, and 24 hours for those people that don't need somebody there imminently. We look to do an assessment of people's needs. We gatekeep the hospital beds in terms of an admission to a psychiatric ward. And we have a dedicated home treatment team where we look after people within their home environments, or again with carers or relatives, to try and offer them an alternative to hospital admission in their time of need. We've got community treatment teams for older adults and our working age population, working across that Monday to Friday footprint, currently 9 to 5. And like I've mentioned, our inpatient services at St George's Park. We've got dedicated mental health practitioners based within our primary care services, working closely with GP colleagues. And we've got our drug and alcohol services based here in Berwick as well. We've got specialist neurological services in terms of Walkergate Park, which is based further north of town. And we've got learning disability services, again, based throughout the Northumberland area that work into people's homes and offer a clinic type of intervention. And last but not least, we have our children's mental health services, which are fantastic provision that we have. The main site is based in Morpeth, but they again are based across the whole of the Northumberland footprint. So really wide ranging in terms of what we can offer, both dedicated inpatient services, but really far reaching in terms of outpatients as well. One area that I haven't covered and that isn't on the slide is our psychiatric liaison service as well. They work out of all of the hospital sites, NSEC, Alnwick Infirmary, Berwick Infirmary, and then across to Rake Lane at North Tyneside as well. And they offer that rapid mental health assessment for anybody that's presenting to A&E within a hospital setting, or maybe having a stay on one of the wards in our acute trusts, to really try and support any elements that people may need, looking at that holistic approach. I'll hand over to Kath just to talk specifically about the Berwick area.
Thanks, afternoon everybody, and as Chloe says, thank you for inviting us. Just to wrap up our slides, I guess I just wanted to draw people's attention to where our provision is in Berwick itself. So people who are local to the area probably recognise some of these buildings. And I guess what's most important for me to say at this point really is that it's not just about the buildings that we've got in Berwick, but actually it's the service that we provide in Berwick from a community perspective we can provide anyway. So whether that be most appropriately provided in somebody's home, in a GP surgery, in Anderson Court, at Wallace Green, whatever is most appropriate for our patients is what's appropriate for us as well. Obviously we need to take into consideration issues around safety and practical issues, but where it's appropriate, we're more than happy to see people in their homes. That includes our crisis service. I think sometimes there's a perception that because Berwick's so far away, it's more difficult to get to. But an example that I've been asked to share is somebody, for example, who might need support with medication 2 or 3 times a day. That won't be an exclusion to access in any of our services. We will provide that if that's what's needed. More specifically, we can see from the slide that we do provide our services directly from Anderson Court and from Wallace Green. And we've got, as Chloe's already said, we've got primary care specialists based in your GP surgeries as well. What's really lovely, and I guess to take some of what Jane's talked about in terms of our transformation, the more that we're aware of I guess services around us and what we can provide within a locality, the more familiar we become with each other and the more we can utilise each other's buildings. So an example from that, from our point of view, we've got some really good work happening in the Berwick Family Hub from our children's services perspective. So we started offering welcome meetings for people who've got children who might have a neurodevelopmental, either a diagnosis or may need to be seen to establish whether or not they have a diagnosis, but some of that work is now happening jointly. And I think that's it. Thank you. Thank you, Chloe and Kath, for that. And I think again, it's the whole point of today was about that delivering in Berwick ethos, and I think that is you've given us a very clear, and I'm sure people in the audience will have questions for you later on, but I think you've given us a very clear layout there, and I think that's really what we needed. Our final presentation today is going to be about something you're probably all very familiar with, which is Northumberland Healthcare Trust. And I'm going to invite Graham Lowry, very appropriate name by the way, Graham Lowry, we've just finished an exhibition here, but to talk about the new hospital, I gather, amongst other things. Amongst other things, I shall leave it to you.
Hi everyone, thank you for having us here to get some fascinating listening everybody, some of which I recognise from having met Chloe last week, so it's been really helpful for us as well to get to know the people and services that are here. Super, thank you. So I'm here obviously to talk about the new hospital and how that's developing. So many of you will know the story of Berwick Hospital a lot better than I have. I've been involved for the last couple of years as developments have speeded along. So I thought we'd give you a little update on where we're up to and what that's going to mean. And there's some information towards the end of the slide, which I now realise is going to look very small in a room this big, which isn't what I expected from you today. So there'll be some information that follows as well. So this is, you'll all recognise the map of what it looks like now and where we're up to. Unfortunately, where it is now, although it's made huge progress, it now looks enormous in the landscape, as you'll see, because of the green hoarding that's on the outside. You'll also be happy to know that that's going to be changing very soon to the more subtle colours that the building's going to be made of in the future, and there's a picture of that towards the end of the slide, so we're happy to show. Also, what many people have commented on in the sort of meet and greet session this morning was the size and scale of the hospital, and that has implications for the community. I understand that, and some people will have feelings about that. One of the technical challenges of building the hospital where it is after all this time is the access to it. Now, I don't know about how many people are influenced by that, but at the moment the deliveries that have been incessant to the site have meant that it's got to the stage that it's at now, and that's because of the construction techniques that we've used. Accessing the site is clearly very difficult for large trucks, and it's called a modern construction technique. It's called essentially our local partners in Cramlin, a company called Merit, and they're delivering the hospital for us, and they build it in modules, which is a very, very effective way of making sure that the build should be in on time. Because most of the buildings built in Cramlin and transported up here, it's not impacted by weather and such. It enables consistency. It also makes us keep to the technical specification that will deliver the hospital at the standard that we require it to be in terms of infection control and the materials that it's going to be built on. Essentially, it's a bit like a Meccano set. Many concrete piles are drilled into the floor. That's all of the noise that's starting to go away now, as they've been completed. A metal frame was built on top of those, and now these modules or pods or pans, they're called, are being lowered into place, which has caused some disruption, I understand, but it's led to where we are now, which is extraordinary progress, and we're very proud to have that where it is now. Some of us have been able to visit the factory too, which is freezing cold by my experience, but the site is enormous, and you can see there the scale of that when you add all of those pods together in such an expanse. It's a tremendous set of activity, and part of the pride that we have in it is it's been built by local people, so Northumberland people work there, not being skilled up to deliver further jobs there, so it's a very, very positive thing. As part of this, when we built many of you have heard some of these conversations before in previous engagement, so I don't intend to repeat that. But as part of that build, you'll see from the original photos how close the proximity is from the new hospital to the old one. And as part of that, we had to remove or knock down some of the existing hospital to make sure that the build came in on time. And to do that, we invested a lot of money in providing the temporary ward that many of you will also recognise from outside the maternity block, adjacent to the hospital, or a few hundred yards away. And that's where this is now. And I was going to describe it as a pleasure to visit, but most people don't see hospitals that way. But I would say it's excellent. I think when it was described as a temporary building, many people have had visions of caravans and the old blocks and all had at school. But if you've been in or you've had relatives that have stayed there, it's a tremendous facility that we're proud to have. That'll remain there until the build completes. That'll be completed in the summer. I'm very deliberately told to say the summer next year. I'm hoping that that's absolutely correct. I've no reason to doubt it. But I think when you appreciate the scale, size, and complexity of the project, many things might influence that along the way, but absolutely it'll be open in the summer next year, which in some ways is sad because it'll be the end of the temporary building, and it'll be the start of the end of the existing hospital as it gets moved and the area renovated largely for landscape and car parking, is going to follow as that build completes. Next slide is also, so again, there's a lot of words on here, and the next slide has even more words. But essentially, these are the lists of the services. So through those engagement events, you know that Northumberland are committed to making sure that no services were removed from the Berwick Infirmary as it was kind of rebuilt into its nearly current position. You'll see here on this slide, there's a list of things that we've particularly mentioned because these are in addition. So you'll see on the next slide, there's a list of what we're providing now, which will continue, and these are in addition. So bringing endoscopy closer to the people of Berwick is great. I know that there's lots of challenge and concern sometimes about the travel that people have between here and Cranmer for specialist care. I can talk about that if questions on that come up, but it's not beyond our scope to move some of those specialist sort of skills and equipment here, which is part of what we're doing. You can see that through endoscopy, through gynecology, and we also have some further services that haven't been here for some at all, and some for a very long time, in terms of audiology, dermatology, etc. on the list below. As promised, this is a slide that doesn't work very well in such a large room. In support of that, though, that slide's taken from a leaflet that's been in development with our communications team over the last couple of months. I'm not quite sure when it's going to go out. There's some logistical issues about postal drops in Berwick because of the border, Scotland, etc. We're just working through those. This list, and there'll be kind of I won't call it a brochure because it sounds like we're selling it, but there'll be a leaflet that will come through everyone's door in Berwick and the surrounding area that will list the services that we have there, and some tips and sort of access points on how to get access to those services as well. Again, really positive in terms of the investment. When it's listed like that, it's kind of grey, isn't it? But I think behind every one of those services is a world of investment that's harder to see. Some of that's about recruitment, some of that's about specialist kit. The geography, of course, is a challenge too. So we have invested in other bits and pieces that are behind that, so things like DEXA scans that currently are only available in the very south of the area. The physiotherapy kit that we have now is very dated, it's been on the site for a long time. That's all being updated as part of the new outpatient build. And our further benefits that many of you already know in terms of primary care and how they're going to be co-located with us. That brings us efficiencies, it probably improves some of their estate too. So some real things to look forward to. And now it's not very far away, so we're talking deliberately summer next year. That's all I've got to say for right now. I hope that's okay. If there's any questions, please let me know. And as promised, this is the facade that it will adopt before summer next year, not the blue or green as it is now. Cheers.
Right. Could we have the house lights up again so I can see the audience? Thank you very much for that, Graham. I will put in here a little plug immediately from Healthwatch Northumberland's feedback, particularly from North Northumberland, particularly from Berwick, audiology services. And we know that that's not necessarily a Northumbria issue, but audiology services are something we continually hear about, and ophthalmology. And so people having to travel down to Newcastle for those services, really, and Councillor Hunter is nodding because she gets it as well. So I was really, really pleased to see those two things on the list because I think they are things that we hear about all the time. So well done for that. Right, now it's time for some questions to our speakers. As you see, they've all been lining up ready for you. I was going to start off just because we obviously before the event we asked the members of the public if they couldn't attend, if they wanted to raise any questions. And we did have one question that was raised with us, which I think, Graham, this will be for you. And this was about someone who had a recent stay at Cramlington at the Northumbria Specialist Hospital and whose discharge from that service was delayed because they were waiting on drugs to be delivered from North Tyneside General Hospital. If anyone who knows that area, that is not a big distance. But actually it took quite a while because the understanding is that there's not a pharmacy at the hospital, at the specialist hospital. Just wondered if you had anything we could feedback about that, or what your your take is on that.
So this is a question that's come up over and over, and I wouldn't say it's an obvious question, but it's consistent. The formal dispensary that we use, which is a highly developed kind of, in some aspect, robotic system of delivering medication, lives or is positioned at North Tyneside. That's been the case since before NSEC opened. That isn't likely to change. It's a very big and efficient system that we don't want to relocate to somewhere else, and it would be inefficient to do so. In terms of the methods that we use to discharge people, are consistently and constantly under review. So you'll know that hospitals need to perform and they need to get better at length of stay, making discharge more efficient, and that's part of my day-to-day work in terms of patient flow. So where there's been a delay, that's unacceptable. I think linking that to what that means to Berwick, and maybe the hope or expectation that there'd be a dispensary or a pharmacy located at the hospital, that isn't going to be the case. From our point of view, though, we'll continue to review and promote development and innovation in service. Many of you have seen the drone trials, right? Some of that was on the news, a lot of you have seen that. It's certainly very early stages. I'm not suggesting that we're going to be winging paracetamol through the sky anytime soon. But I think it gives you an indication of the appetite and risk that our organisation has. And this is an innovation to help with that. We'll do our best with that. The second probable answer to that question is, from where I sit, we need to get loads better at connecting community pharmacies to hospital. The idea that we give out drugs that aren't familiar to the people that take them because they come from a different pharmacy and a different packet and from a different provider, we need to get better at that. And there's a lot of work going on with my pharmacy colleagues to make sure digital scripts, etc., can be delivered or start to deliver that service in a different way in the future, which absolutely should prevent that.
So I think what I gather from that is that's an issue that you're aware of, but working on looking at some innovation, but also recognise that it's part of flow and the patient experience. So that's something that Northumberland is aware of and working on.
It's a much more concise response.
Doing it a long time. Do we have any questions from the audience? Put your hand up and we can get a roving mic to you. Who can I see? Put your hand up and wave wildly. Oh, yeah. Say who you are and who's your question for.
People from the Northumberland Recovery College. It's less of a question, actually. I just wanted to second, throughout all the whole presentation, it's been around networking and partnership working. And Jane made a special point of mentioning the Recovery College. I just want to thank you very much for that. I think it acknowledges the hard work of the last 9 months of the whole Recovery College team. But I also wanted to point out that there are people in this room without whom we couldn't actually deliver a few of our courses and sessions as well. So I just wanted to thank them publicly as well. You know, we've made a lot of connections in the last 9 months, and I think events like this are extraordinarily critical. This is the best event certainly anyone from the college has been to in a very long time. So thank you for acknowledging us, Jane, and thank you for Healthwatch for hosting it.
It's my pleasure. Thank you. Any more hands can I see? Okay, I've got a couple of questions I think while people are having a think. I think this is for Rise really, because I was very taken by your presentation about what you're providing. And what do you think is the biggest challenge facing your service in the next year? Because it seems like you're doing such important, vital work, but what's the big challenge that you're facing?
I would say for Diana and I, our funding runs out the end of March. Wow. So it's trying to secure funding to carry on the service.
Well, and seeing what a pivotal, and I'm sure everyone having seen that presentation, that is a quite scary thought. Yeah. Anyone have any more thoughts? Am I seeing hands there? No? Oh, very good audience. Wait, no, I've missed a hand. Hello.
Liz Pradle.
Oh, it's my boss. Hang on, I've got to behave myself. It's my boss.
No. It's not particularly a question, more of an observation that we sort of see. We deliver 3 social prescribing services across 3 PCNs across Northumberland and North Tyneside. And what you actually have sort of evidence and see where there are a lot of people with very complex issues, and they will have a number of professionals working with them across probation, across mental health, across recovery, drugs and alcohol. But what we see is there's not a lot of working together, there's not a lot of catching up together, and what the social prescribers end up doing is linking the professionals together. And I think it's a whole part of that holistic view about working much smarter together for people. Because I'm sure the panel will know that people have very complex needs, and it's not just one service that is involved with them. And we see it from discharge from hospital and then into the community, and then where across the services work. But I do think there is a little bit of way of it could be linked up a bit smarter.
Any reflections? Oh yes, Jane.
Thank you. Off my microphone. Don't tempt me. I'll start to sing. That's a really good point, and I'm really pleased that you raised that. And when I started to talk about community mental health transformation there, my voice always goes up a bit of an octave because I've been working on it for a number of years and I'm really excited by it. And part of that is because that's exactly what we're doing, bringing people together from different organisations across the whole system. So working with people like Kath and Chloe here, to ensure that if we have somebody who is complex, and let's face it, most of us are pretty complex, it means that we can bring together a group of people who are able to discuss, with the individual's permission, a number of different issues. And often those issues aren't just about somebody's ill health, they're about the reasons why someone is so poorly, what is making them ill. Why is somebody feeling so stressed and out of control of their life? And there are lots of different determinants that can create that scenario. And so as a result of that, we're looking at things that we're calling multi-agency meetings, working in the community in lots of different settings across Northumberland, so that we are, people have told their story once to an individual, and that story and the support that they need is then shared with a group of people who together can think about who will be able to help. And that isn't always about one person or one organisation. Often that's a whole host of different people, but at least doing it all at the same time, almost like a bit of a one-stop shop really, so that rather than having to navigate a really complex system, and it's sometimes complicated for us, we kind of prevent all of that, and at the same time our services are beginning to understand so much more about each other and what we're doing and how we're working, so that something that happens over here in Northumberland will eventually, through a kind of bit of a spider's web if you like, impact on something over here. So we're really working hard with that multi-agency joint working.
And I think that multi-agency joint working is exactly the thing, but it's also about, and I think your slide actually said it's about knowing on the door, because I think that is the issue for people. If you can be as joined up as you like, but if people don't know or go to the wrong place or don't understand that, then actually you aren't joined up. And I think that's why I was really pleased to see that phrase on your slide. So thank you for that. So yes, and I think the fact that you're all here is testament to that. I've got a question from Lizzie, which I'm going to suggest, because it's multifaceted, that I think needs a considered longer answer. It's to Northumbria, and it's about the actual services that will be in the hospital, in terms of urgent treatment and things like that, and also services for younger people. So what I'll do to any questions that have not been asked, if you want to put them in the green box at the back, then we'll pick those up and we'll get answers. But Graham, I'll ask you to give me an answer to that we can then pass on to Lizzie and to everybody else in due course. Is that okay? Yeah, yes, just stop you talking. Yeah. We're all going to go out and enjoy the sunshine. So, as there aren't any more questions, I'm waving wildly at me. Oh, thank you for that, and thank you to all the speakers. Oh, hang on, we've got a wave. Hello.
This is for Graham.
Oh, you can speak.
Yes. Are endoscopy and colposcopy the only definite new services that the new hospital will offer? And if so, when will the decision be made on which possible additional services will become definite?
Yes, that's quite difficult to answer. So yes, they're new services and they're the ones that we can kind of announce right now are going to happen. I don't think there's a finite date on any new services coming because it's obviously it's really complicated to respond. Some of it is in our gift, some of it's in partnership with the providers, etc. Audiology or ophthalmology is another example of that where we need Newcastle to work with us, etc. So no, I don't have any other future services I can confirm, but no, the door's not closed to anybody and there is no date on which that door does close.
And another question, if you don't mind, how are you planning on measuring the success of the new hospital, and will local people be involved in that assessment and feedback?
Yeah, it's a good question. So it's really complicated to answer because there's lots of measures of success. Some of that is about not quite tedious numbers, but things that aren't exciting. You know, how long people stay in hospital, how many times they come back to hospital, how many infection issues do we have? All those things are measures of success. In terms of public and community engagement, we'll continue that through our governor's board system. I think I'm not sure the timeline that the public engagement events that continue are going to continue, but I would certainly recommend or suggest that they continue for a good while. Yeah, I suspect the first few that follow after the opening of the new hospital will be critical in how we take that forward. So I think all of the input we've had so far has been really valued and it will be also in the future. If you have a really keen eye on the diagram that was on the table earlier, yeah, I couldn't see it either, but they are on there. If you look closely on the diagram, there are 24 inpatient beds, so it's one ward. We don't plan to have 24 beds open all of the time. The ward will be structured around 20 beds, which is what well, it's not what we currently have now, obviously in the temporary ward, but until we closed Ward 1 for the temporary ward, there was 20 beds. The 4 extra beds will be used to mitigate loss for infection control, equipment breakdown, etc.
That's great because the original plan was only 16 beds, I believe, so that's really good.
Yeah.
Lovely. If there are no more further questions, then thank you for the ones that you have raised. Huge thank you to Derry actually for steering us through the session, but above all to our guest speakers here, and to you all for coming to share the time with us. We've had a really productive day here in this wonderful city in Maltings, thanks to the team for making it happen. But I think one of the things I was reflecting on just listening to the various conversations, and thank you, Graham, for your really good slide, because what it does show is there's a huge amount of services, and that's just one of the organisations sat around the table here, making these services connect for the benefit of the users, both in health and social care, is very, very tricky. We've got a huge geography, we've got a wide range of services, and actually we don't always get it right. We are very clear what our role is as Healthwatch. Hopefully you're a little wiser now as well about where we in Healthwatch fit in. Each of the organisations is also listening. We have a phrase in Healthwatch, we're here to hear. Sadly today we're not going to hear Jane singing, but that we could arrange a separate venue perhaps for that. But we are genuinely interested in hearing questions. If you haven't had a chance and could to get it in today, or you've got a particular comment that you'd like to raise, then we've got a little form in here in your pack. We've also left a feedback form, pick one up on the way out. Above all, we're on the phone, we're on the internet, and we're out and about. So our here-to-hear sessions you can find on the websites with the dates as well. They are very regular. That's really all I need to say, certainly for this year. We're just about at the end, but we will do this again in 2025. We're so pleased with this particular venue. It would be lovely to be here again. We do tend to move around. We don't know where we'll be for our 2025 review, but we do have a question for you about that as well. We've done this today in the afternoon. We did this last year in the afternoon with a similar sort of end, sort of late morning and followed on to the afternoon. So our question for this year is actually, would you like it to be in the evening? Would it be easier for those who aren't directly involved in the event. If it were in the evening, don't need an answer now. Drop us a line, leave us a note. But that's one of the things we're thinking about for next year's event. But for this year, that's it for today. Thank you so much for your time, for everyone for facilitating it, and particularly to our panel. Thank you very much.